Hi, I'm Perry Atkinson, General Manager here at theDove. Hey, check out our other videos and check out our website at theDove.us. Welcome back. Well, we have a very special guest. We have Barby Ingle with us. She's the Executive Director of Power of Pain Foundation, a volunteer chronic pain educator and pain advocate. And I don't know if you deal with chronic pain. Perhaps you do. Her own story is fascinating. What's going on and the results of this financially and the impact upon people's lives is just incredible. Barby, nice to have you. Good to see you.
Thank you, Perry. Thanks for having me.
Yeah, your own story is fascinating. Quickly, just give us the Reader's Digest version of it.
In 2002, I was in an auto accident. It caused a neuroautoimmune disease to start, and it left me in a state where I had chronic pain as well as some other symptoms going on, and it took 3 years for doctors to diagnose me. During that time, they did everything from take out my rib to shoulder surgery. I had tumors grow in my mouth and had to have oral surgery, internal bleeding, and then it still took another 4 more years after that to get the proper treatment.
Wow, so you went through all of that before you realized you were being diagnosed wrong.
Correct. Three years until I got the proper diagnosis, and then 4 more years until I got the proper treatment.
Not to mention, financially, it took its toll.
It wiped me out. I went from doing very well in life to food stamps and bankruptcy, and I've had to build myself back up and learn the medical system. And that's why I speak out, is because this shouldn't happen to other people, but we're not taught. We should be taught from childhood, but we're not, how to deal with the health system, especially dealing with the bills that we're going to be facing with a chronic disease. So
what's happened here, Barby? Is the system broken? I mean, don't they look at things carefully?
The system is broken. However, JCO and the Medical Billing Association of America have said that they've done studies and shown that 8 out of 10 medical bills has a mistake. So if the consumer, the patient, isn't aware of this and isn't checking their explanation of benefits when their insurance companies send them statements, or they aren't filing for appeals, they can amass a large amount of medical bills, and a lot of them could have been avoided, or you didn't even owe the money in the first place. It all was due to a clerical error.
Wow. So how did you become a pain advocate?
I became a pain advocate because of what had happened to me going through the process of dealing and learning how to deal with a chronic pain disease, and realizing that I didn't have these skills and I had to learn it the hard way. I paid thousands and thousands of dollars that I didn't need to pay. And going through this experience and looking back, had I just taken a little time in the beginning to look at my explanation of benefits that my insurance company sent and compared that to what the doctor's bill said, I would have seen that my patient responsibility was a lot lower than the amount of money that I ended up paying out. And, you know, I even sold my house to pay my medical bills. So I went like from the top of the world to having nothing. And I could have avoided a lot of it had I just known how to read those bills.
Are you in pain today?
I am in remission today. I undergo infusion therapy approximately every 3 months. It's a 2-day infusion, similar to what a cancer patient goes through with chemotherapy, but they use other medication that works on my nervous system. I did end up in a wheelchair for a time, almost 7 years, and I'm able to walk today. So I am getting the proper treatment, and it just took a while to learn the process of how to do that and how to get my insurance to cover it.
What is RSD?
RSD is a neuroautoimmune disease that they found in 2011. There's 2 autoantigens in my blood that attack my system. R stands for reflex, anything in your body that's automatic, your heartbeat, your intestines, your vision, hearing. So it affects all of those areas. Your sympathetic is the S, and that's my sympathetic nervous system that causes chronic burning pain, as if someone put lighter fluid on me and caught me on fire, and I just couldn't put it out. And dystrophy is a loss of muscle and bone. So I do have a lot of osteopenia and loss of muscle. So I have chronic weakness as well.
Wow.
Yeah.
You know, you're also another fulfillment of something I've said for so many years on radio and television. That is, whatever God saves you from or brings you through, he turns you around, makes you a minister too. And that's exactly what's happened to you. Absolutely.
From the age of 4 until my 30th birthday, right before my 30th birthday, I was a cheerleader, and I was doing the flips and the gymnastics and the dancing, and I thought that that's what I'd be doing the rest of my life. And then this happened to me, and here I am 12 years later, and I'm still a cheerleader. Now, instead of being a physical cheerleader, I'm a cheerleader of hope and possibility, and I strive to win this game of life.
Yeah.
And I hope that everybody else on my chronic pain team can join me in this fight, and that we can stand up for ourselves and be our own best advocates. So
Good for you.
That's my purpose from God.
Good for you. You bet it is. You know, I don't know, unless somebody is dealing with chronic pain, people don't understand chronic pain and how debilitating it can be. And sometimes we just think, well, it's psychological.
And it does, chronic pain can cause depression, but depression doesn't usually cause chronic pain, which is a misnomer that people have. And yes, you don't understand it. Prior to my accident and getting sick, I was a head coach at Washington State University for the cheerleading and dance program. And when my kids would hurt themselves, I would say, suck it up, put an ace bandage on, wrap it up, put tape on, get back out on the field, we need you. And then this happened to me, and I realized that there's sometimes that there's things that you just can't overcome so easily. And like you said, until you have it and until you experience it, you don't always understand. So, you know, it's hopefully sharing my story and getting other people to share their stories gets a better understanding in society so that we can do better for our pain citizens.
Has the Obamacare further added to the mix?
It has further added to the mix. Getting new treatment options passed by our insurance companies was very difficult. And now with Obamacare, there's not really an incentive to get anything new passed by the insurance companies. It's going to be even more difficult to get the procedures. For instance, the treatment that I get at Drexel University, there's a waiting list of up to 5 years for patients with the same disease I have to go in and get the treatment that I got that got me out of a wheelchair. And so the impact of Obamacare is just basically slowing down even further the care that we're receiving.
All right, so what do you provide? What can people do to get a hold of you, and what do you do for them?
Sure. I am the executive director of the Power of Pain Foundation, and we do education, social events, awareness events, and access to care issues. We do patient mentoring. We provide resources if patients are having trouble finding a provider in their area that treats their specific condition. We can help align them with the providers in their area that treat lupus, Lyme disease, MS, RSD, Sjogren's, one of the 150 different type of nerve pain diseases that are out there. So they can check out our website, powerofpain.org, for more information, and also to contact me. There's a contact form at the bottom of every page. It's real quick and simple. Fill it out, submit it, and we'll get back to you as soon as we can and help you out.
You mentioned Lyme disease. I know some people who are suffering from that, and a lot of people don't even recognize it or test for it.
Absolutely. Sometimes Lyme disease can be difficult to test for and check for because it can hide in our systems. It can hide in our muscles, and then all of a sudden one day decide to come out or get triggered by, you know, a trauma to come out and attack our bodies. And so with Lyme disease, you really have to get a test specifically where the tick bit you, or you have to do a DNA test, and there's only a few labs in the country that are doing those tests. So it can be difficult to diagnose, and then to treat it, you have to, the Lyme disease itself can form a little sac around it to protect it from being killed off by the antibiotics that the doctors are giving us. So you kind of have to get that sac dealt with first before you can go in and kill the Lyme disease. So a lot of people end up with chronic Lyme disease because they're not being treated properly.
Wow. Fascinating. You know, I think you point out something here. We get overwhelmed when the bills come in. We look at it, we look at the number, and we're not even looking at what the charges are and how many of those things can be challenged, and that's where you come in, right?
Absolutely. And a lot of times the insurance companies will flat out deny a whole claim, and patients will freak out and, you know, they don't know what to do at that point. And I always say, make sure that you file your appeals, because a lot of times they say no on purpose the first time through. It saves the insurance companies a lot of money, as well as, mistakes are made in those medical bills. So check your medical bills and make sure that you're only paying your patient responsibility portion.
I'm out of time, Barbie. Thank you. It's called Power of Pain Foundation. Thanks for being with us. We'll get together again soon, okay?
Great. Thank you, Perry.
Okay, thank you. We'll see you next time on Focus Today.